is interested in public health and the use of innovative approaches to end major infectious diseases. And today he will be talking to us about TB prevention targets, finding synergies between the HIV and TB programs. Please.
Thank you. So in the next 10 minutes, I'm going to talk about the UN HLM TB that happened last September 2018, the target set there and the relevance for this meeting and for us on this topic. So as was said in the beginning, this recommendation of TB preventive therapy is not a new one. It has been there for so many years now. If you look at the WHO guidelines, I just put two of them, specifically on TB HIV, 2004 and 2011, both have recommended TB preventive therapy for people living with HIV. And this, after some years, we Stop TB Partnership, along with MSF, did a report to look at country-level policies on TB. And we also included TB preventive therapy. And very interesting, 29 countries surveyed, all of them said they have policies for TB preventive therapy, at least for two groups, child contacts and people living with HIV. So policy is there internationally as well as at the national level in most countries. Now, what is preventing those policies being acted upon? We looked at data that is reported from WHO on TB preventive therapy coverage for people living with HIV. And I think the first and most important point glaring that comes out, which I would like to highlight, is only 67 out of close to 200 countries, member states reported in 2017. That's the last year for which the data is available. So just imagine, most countries didn't even care to report. So that's the biggest glaring problem there. And if you don't measure something, it will not be done. All of us know that, all right? Now, if you look at those countries who reported, the total adds up to about 1 million in 2017 of people living with HIV who received preventive TB therapy. And 640,000 of them were in newly enrolled people on HIV care. If you look at one country, South Africa, the global total, 39% comes from South Africa. And if you look at the map there, the green means very good coverage, red is very poor coverage, gray is actually no data. South Africa is not yet in the green. Great potential to go further. But just imagine South Africa, one country, contributing 39% of the global total. Congratulations to colleagues in South Africa. You also see that Russian Federation, which does quite a bit of preventive therapy, you see that country in green there. Coverage can be looked at with different denominators. If you look at those countries where this could be estimated for people living with HIV that were recently enrolled in HIV care, it was 36%. But if you take the denominator as the global people who were initiated on antiretroviral therapy recently, that's a lower figure. If you go further and look at all people living with HIV under care, that will be even a smaller figure. So coverage is really low, and countries are not reporting to WHO. We must change that. Now, because of this and many other things in TB, as Eric described, the progress was not good enough. The UN high-level meeting in September 2018 in the UN General Assembly, one full-day discussion happened on TB. You can look at the pictures there. Before the UN high-level meeting, there was also a civil society hearing, which actually nailed with a lot of important points, which went into the political declaration. There were also many side events. Celebrities came together. There was a TB Innovation Summit. It was unprecedented visibility for TB. Now, what got left behind and what is available with us is the political declaration. I must say a very strong one, with some bold numerical targets as well as some commitments which are qualitative. I'm not sure how many of you have seen this document. The document on the left is a 10-pager. Because people said it is complicated language, UN language, we simplified it and put it into a 4-pager on the right side. So there's no excuse not to read it. It's available on the Stop TB website. So I encourage you to read it. And I will come to the relevant part. If you look at paragraph 25 in that political declaration, This is what it states. I want to highlight the ones in the red underline, very important for us. It talks about rapid scale-up of access to testing for tuberculosis infection, so not just treatment, testing as well for TB infection, not active TB. Provision of preventive treatment with a focus on high-burden countries. So this 30 million is for high-burden countries with a focus there. Then, if you look further, it says at least 30 million, and we had a lot of debate even when the figure of 30 million came. This is the floor and not the ceiling, so we should aim higher. And then it gives you a breakup of the different categories: 4 million children, 20 million other adult household contacts, 6 million people with HIV. Whatever way you do the calculation, and I will come to that, it will exceed 6 million if we are serious about providing TPT to people living with HIV. And I'm very encouraged that some countries are already planning to go higher, and some partners as well. And so it says very clearly, receive preventive treatment by 2022, and with the vision of reaching millions more, because 30 million itself will not have the impact that we need to end TB, even in people living with HIV. Now, what does that 30 million mean to individual countries? People ask that question, what is the country share? So, as Eric presented, there are so many numerical targets there. 40 million active TB treatment, children with TB 3.5 million, MDR TB 1.5 million, TB preventive therapy 30 million. All of them have been broken down now by country. So we did that working with Stop TB Partnership. We did that working with some partners. It's available on the website. You are encouraged to have a look at it. These are indicative targets for countries, and we encouraged countries to do their own targets, but also to think ambitious and exceed those targets. There's also a funding target of $13 billion per annum, which is needed for TB, including for this activity of TB preventive therapy. Currently, resources available are roughly about half of that. And in addition, we need research funding for TB, which is $2 billion per annum. And currently, the available funding is 1/3 of that requirement. So on the website, these figures are there, broken down by country. I encourage you to have a look there. If you look at the numbers, on the total TB preventive therapy, that's on the left side. This is how we need to scale up. Currently, as you saw, less than 1 million a year. We have to reach a stage where we should be initiating 9 million plus people on TB preventive therapy in order to meet the target. If you look at the right side of the slide there, these are the different groups in which preventive TB therapy will be scaled up. The main groups, there are of course other groups. If you look there, people living with HIV is not the biggest group, but is an important one, the yellow line there. Now, one other thing I want to point out is very important for us to look at, because we know that it's not being measured, so it is difficult to make people accountable, but hopefully measurement will start. So the accountability paragraph also calls for 2 checkpoints. One is a report that goes into the UN high-level meeting in 2020, happening next year, and then a full review in 2023. These are opportunities where progress can be reviewed. Now, UN HLM targets are a great opportunity. What is needed, I would summarize under 3 kind of broad action points. Number 1 is action. We need TB programs and HIV programs to work together synergistically to achieve these targets. Greater responsibility for the group, which is people living with HIV, should lie with the HIV program, because people living with HIV are coming in contact with them regularly. Technical and operational aspects need to be looked at. There are many questions in that area. Some of them we will get into today, but these are important for field level action. Number 2 is resources. For ruling out active TB, we need a lot of things. New regimens are coming. We will hear about some of them. Shorter, safer, more effective. That will need resources. And finally, accountability lies with both the programs and also with the world leaders that have committed for the targets. So the first point I want to emphasize is TB preventive therapy is essential. It is essential. It is not a choice. We need to be very clear about it. to reduce the burden of TB among people living with HIV. But also, if you look at the End TB strategy, it makes it very clear. Without TB preventive therapy, we are not ending TB. So if you are doing an NTB strategy, that's part of it. Number two, in most countries, policy is in place. What probably is absent is the implementation and the monitoring. Very important that monitoring needs to be done there. UN HLM targets are a great opportunity to change the current status quo. Country-wise targets are available on the website. We encourage you to use it. And we need to hold programs, partners, and world leaders accountable with these targets and commitments. Thank you. I want to put that, what Maureen said in the beginning, we need to put people in the center of our response. Thank you.